Welcome back to Doctor's Nutrition Series on cardiovascular testing and how you can take care of your cardiovascular health.
Yeah, today we're going to be talking about testing the thyroid and adrenals. And you're thinking, oh my gosh, we thought we were talking about cardiovascular. We are. We're going to tell you how testing those areas can affect your cardiovascular health as well.
Yeah, and it's rare that you're going to get a cardiovascular testing done somewhere that's going to include the adrenal testing or the thyroid, because they don't tend to quote unquote go together.
Right.
And they very much do.
And we're going to talk about thyroid first. On thyroid testing, you never just want to check a TSH. A TSH is the thyroid stimulating hormone. It is the message from the brain to the thyroid telling it to work. That is a number that when it is elevated, it means your thyroid is probably low. It's not always an end all. That's why I'm going to tell you, you always want the thyroid hormones checked as well. We have actually seen over the years, it's kind of scary, a lot of doctors and nurses read the testing wrong because it is confusing to some people. That when the TSH goes high, it means the thyroid is low. And when it is low, it means the thyroid is high. But we say, still can't tell from that. You have to go back and look at more information. You want to at least do your T4 and your free T3. T4 is going to tell you how much thyroid hormone you're making. Free T3 is going to tell you how much usable thyroid you have available.
The free T3 is the one that actually sets the metabolic rate for every cell in your body.
And with it setting the metabolic rate, yes, it's important in cardiovascular health. If free T3 is low, you tend to have weight gain. You tend to have higher lipid levels. I have people, they have this extreme cholesterol and they don't respond to anything to help it. And we don't say all cholesterol is bad, so that gets into a whole different area. But say we do think somebody has the bad patterns, and there are people with bad patterns. We put them on something to lower it, and it doesn't work. It's normally because the thyroid's not right.
Yeah, we see that actually more than you would think, where a person has, they're on this massive dose of, I get them occasionally come in, and they're on some really big doses of statin drugs, and yet their cholesterol's really high. And their triglycerides, everything's off. And they're doing the right things, so to speak, diet-wise, et cetera. And you're thinking, okay, what else is going on? Have they checked your thyroid? Most of the time, the patient doesn't know.
Right.
They'll say, well, I'll always tell them, and we do a free consultation, so you can always do this with us if you want an opinion. Get the lab work that's been done on you, bring it into us. We'll look at it. We'll give you our opinion of what's going on and what hasn't been checked.
Or email it if you're from a distance.
If you're from a distance, right. Yeah, just email it to us. We have that probably more so than bringing it in. But just do that. That way we can look at it and tell you what's going on. And we see it all the time. We'll look at these really high or uncontrollable cholesterol levels, and it's freaking the cardiologist out because they're giving you some really big doses. And it's not controlling it, but they've never checked the thyroid. Check the patient's thyroid, and it's what we call subclinical.
Yeah, sometimes it's outright a problem. Sometimes it's what we call subclinical, which is it falls within the range barely, but it still could be the problem. So we look beyond normal, and that's what you have to do. I mean, you can be barely in range and a lot of times be told that you're fine. We do not think you're fine if you're barely in range. Yep. We have optimal levels we go by, and you want the thyroid to be optimal to actually ensure that you have cardiovascular health. It does affect the cardiovascular health. It does affect your weight, and it does affect your lipids. So for that reason, we do tell people they need to have their thyroid checked when you're looking at cardiovascular health.
Right.
Now, the next thing we're going to talk about is adrenals. Now, adrenals, why is it so important to the cardiovascular system?
Well, without certain adrenal hormones and with too much of certain adrenal hormones, like cortisol. Cortisol's and a lot of people have heard about cortisol. It's just quote unquote stress hormone. It is. It's your body's reaction to stress. Now, the problem with high cortisol, you can mess up things like blood sugar, you can mess up your lipids, your triglycerides, et cetera. You can do a whole bunch of that. Blood pressure, all that is falling under the umbrella that's taking control of that cortisol.
Right. So if you are very stressed and you have adrenal issues, you can be affecting a lot in the cardiovascular system. Like he said, you can be having high blood pressure due to that. You can be having lack of sleep due to that. You can be diabetic and it be one of the primary causes. And everyone knows diabetes increases your risk for cardiovascular.
Exactly.
And they know it increases it a lot. actually in the research. So the adrenals also play a big role, and you want those adrenals to be optimal. You have to have cortisol. You don't want to just lower it to nothing, but you want it to be normal, and you want to be able to adapt to stress better and be able to cope with your stress. So that's why we actually check the cortisol and the DHEA when we do our cardiac testing.
Right.
Our cardiac testing goes way beyond just cardiac, because if you're looking at cardiovascular health, you have to look at the whole picture. Our body is a whole, and we can't treat it as just parts.
True.
Yep.
And that DHEA, it is one of the primary, if you will, endocrine hormones. It really is. It's an androgen. So it's going to turn into estrogen and testosterone.
Right.
Both.
It actually affects your sex hormones.
Right.
And just like we talked about before, things that actually are good for the heart are good for the brain. And DHEA is very beneficial for memory and clarity and energy and things like that. Which, how many people with cardiovascular problems do we hear every day say that they're so tired they can't go? We hear that so often.
It's a common complaint.
It's a common complaint with people that already know they have a problem. Mm-hmm. And it's a common complaint, and we find out that is the problem. So you definitely want to look at the whole picture. You don't want to just look at parts.
That's very true. So it's about finding all of the pieces and parts of this really big puzzle that we call health. Mm-hmm. And if we do enough testing in the right areas and understand it well enough, you can risk manage all day long. You can take any kind of risk that you may have, and you can make it just a little bit better.
Right.
There's ways to make it better. No matter what it is, no matter how bad it is, you can make it better.
We have a lot of people that come to us that's already had a heart attack. We see many of them. A lot of people wait, like human nature is to wait until you fell apart to try to do something about it. Now, we prefer people not wait until they fall apart, but those people need help too. So either one, we are here for a free consultation, either way, whether you're just trying to prevent or whether you've already had a problem. Because if you've already had a problem, you know you're at risk. There is something that is doing it.
Yes.
And I guarantee it's not just your cholesterol. And that is what is looked at medically as, lower your cholesterol. But then 50% of the people that have heart attacks have normal cholesterol. So there's a lot more factors than just cholesterol. So you have to look at the whole picture. So if you have any questions, just feel free to call. Like I said, always a free consultation. If we are busy, leave your name and number, and we will return your call. Or you can go fill out one of our consult forms on our website, which that gives us just a little bit of background and a little bit of information to have when you do call.
Right. If you've got something out of this, stick around for the rest of the series, because we're going through a whole series of testing that's kind of specific to the cardiovascular system. This is just one of those. Thank you for joining us. We'll see you on the next one.